the nurse who at my GP let me film her essentially pushing out all the pus of the wound that we told them would get infected because it wasn't a vac dressing like it should have been and like we were promised it would be, and we told them this would happen. As she was pulling the steri strips off, it exploded with pus. And then I had the nice little video of the rest of the procedure she did, where she had to extract a lot of the pus out because the pressure from it was why I was in so much pain.
This is In My Shoes. Wheels Optional. The world from a different perspective. Supporting and educating the world, busting the stigmas of disability and invisible illnesses.
Thursday night, so it's Thursday, Friday, Saturday, Sunday, not 5 days.
Could also explain why. Oh wow, that's really sore internally. Pull it off. Still coming.
Yep.
Oh, that's really sore. Okay. Because it's like a pussy.
Yeah, bloody pussy discharge. Yeah.
Would it explain why I'm in so much pain?
You been feeling sick? Like,
Yeah. No.
can you see that from there?
Yeah. That's why I'm recording it, because I can see it on the camera. It's very thick. And it wasn't that red last night, was it, Mum?
No, it wasn't.
That redness is very new. I wonder if he'll do what he was supposed to do now. I just find it hilarious, just as we're talking to you about it, and then you pull it off, and then, oh.
Yeah, it just started, just straight out of.
I guess.
You might have more, like it's getting worse now, but I guess as soon as you move, or get upright,
Yeah, it's gonna.
it's gonna leave it.
At least I was right in saying that there was yellowy stuff under the thing, and that we came in to get it checked. Well, it just keeps coming, doesn't it? Because it's felt hot to the touch
Yeah.
for days, and they're like, oh, hot to the touch is normal.
If you're on antibiotics.
And oral antibiotics don't work for EDS. That's what we're finding. Only IV ones work because our guts don't absorb things
You don't
properly.
respond to you.
Yeah. Well, the wound's 4 centimetres by 4 centimetres. So
The wound itself looks good. Like, you know,
the outside skin.
yeah.
But I mean internally there's like a 4 by 4 gap. So
Thank you.
yeah, that redness is just everywhere now. Because there wasn't any redness.
Lucky this can come out.
What do you mean?
Well, I guess it's got to a stage where there's such a big build-up internally.
It's more that stitches don't work for me. My skin always pulls apart when there's stitches.
Is it still hot?
Yeah. Oh, you're right. I'd rather get it all out. Because is it worth like nicking one of the stitches to let it drain?
No, well, that's not me. We'll see tomorrow.
Okay.
See if see if it feels better,
Like, won't it'll get worse?
or whether it's, making you.
Well, it's already been making me very sick, hasn't it, Mum? Just, they should do what, works. And stop putting me in the, let's try this first.
Yeah.
Let's try the same thing we've tried 13 times. And they wondered why we got so upset. Because we knew this was coming.
I saw your name in the book and I'm like, yeah.
Yeah, it was just because of last night I saw yellowness under the pad. And I thought, oh, we better get it checked out before. Like, better to check and See, it's nothing then.
Oh, it's too late. Yeah, it's really sick again.
Well, just because infections always get me so hard. Because I have no immune system, so I
That's right.
can't fight a lot of this stuff. Go for it.
How hard is it to do a procedure without complications? You know what I mean?
For me, or like in general?
Well, in general, but
When we're saying that these complications are going to come around if they don't do it a certain way,
yeah.
and then they do it that way anyway,
Yes.
we don't understand it either.
Okay, well, I'll put some steri strips back on it.
Because yeah, I've felt tearing pain on that left side a lot as well, so
See if any more comes out tomorrow.
probably. Maybe that's why that left side was really distended, Mum, because it was all sitting in there.
Oh, yeah. Under the skin. Yeah, probably.
Because it looks flatter now.
There'll be a pocket or something somewhere.
Probably another abscess.
And,
Yeah, that left side's where all the pain mostly coming from.
okay.
So you just get it changed every day again.
I know.
How many months? Nearly 10 months of this?
This is freaking fire card, hey?
Pretty much. I always kind of wonder how many times we got to say something before
Before
the...
it's listened to.
Yeah. Like, at least after all this, they might believe that we've tried it all the other ways. Yeah.
Yeah, I'll put a waterproof on there.
Is it worth doing the other way? Because that's what he did as well.
Okay, yeah, sure.
Okay, I'll do that. There's no rolling.
Like a bit more of a pad and then a waterproof
Sounds good.
in case it leaks.
Yeah. I guess it's kind of a good thing that stitches don't quite close my skin.
To release all that
Pus.
because it does stay in
That's when I get the abscess, yeah.
and just walk through it.
Yeah.
Is that like you've been itching?
Which,
Yeah, she got really itchy Saturday night.
because I had a reaction to something they put on.
Yeah.
But it might have also been the infection, I don't know. But yeah, I've been on antibiotics since the surgery. Like, before the surgery I was even on them. But I think we've all researched it, and yeah, just oral ones do not work. Which is...
Well, see what he says.
I'm getting so fed up with doctors not listening. So after being released of hospital, you can see that nice little video of the nurse who at my GP let me film her essentially pushing out all the pus of the wound that we told them would get infected because it wasn't a vac dressing like it should have been and like we were promised it would be, and we told them this would happen. Again, I'm getting like this swelling in my face. I actually didn't have that a few days ago after the surgery. I was really happy about that. So we've sent the photos to Dr. as well as Mum's called his nurse to ask what to do, and they're now going to admit me to his hospital in Brisbane, so it's not even my regular hospital, so I'm going to have to start all over again with educating them on EDS and my allergies and my POTS, because every time I go to a new hospital that has to happen. I've been there before and I've had surgeries there before, but that was with really bad doctors and doctors who didn't know about a lot of the diagnoses I have now. So I'm kind of glad I printed out the admission form for the other hospitals so that I don't have to write out every single condition and everything again. Hopefully that will help, but yeah, just so f***ing fed up with it. Even the nurse, she's seen me from 9 months ago when all this started. Literally, as we were talking to her as she was doing the dressing change, she asked about, I had the surgery go, and I straight out of my mouth went, well, we got promised one surgery and had another, which we know is not going to work, and we should have had a vac dressing, but we've had him stitch it up completely, which doesn't go well with my EDS or immune issues. And then as she was pulling the steri strips off, it exploded with pus. She had to extract a lot of the pus out because the pressure from it was why I was in so much pain. And we think this is why I had that episode of pain the other night where I was just in so much agony. And it was probably the beginning of this infection, which has probably filled the entire 4x4 centimetre wound inside. And as Dr. said, oh, you won't know it's infected till it explodes. And it's like, yeah, it's been how many days and it's already infected? Maybe he'll believe us this time. We don't know much what's going on. We know I'm getting admitted, and then I'll keep you all updated on what's going on. Okay, bye.